has arrived.
Good afternoon. This is Brady Borrell coming to you live from Teche Action Clinic in Franklin, where Dr. Gary Wiltz, the Chief Executive Officer of Teche Action, will be receiving the first COVID-19 vaccination here at Teche Action Clinic. They will also be administering the COVID vaccination to approximately 20 staff members here at Teche Action. And we will also be talking to Dr. Wiltz after his vaccination, which he will be receiving momentarily. Dr. Wiltz.
In administering the vaccine, as you may recognize this celebrity, Cecile Gray, who has, I think, about 50 plus years of doing this.
Yes.
And she's given me all my vaccines.
Just relax.
So here it goes. Tell me when it's been given, okay? Can you give it now? Oh, it's done.
Painless.
She gives the best shots. We had to get out of retirement here to come give that. This is what's given to the patients after. It's called Be Safe. And this is also a vaccination record card that we'll give. When you take the first dose, then we automatically schedule you for the second dose to be administered. And then we're going to get some of those stickers made, but as you can see, what does that say? Vaccinated. So
Yes.
I've been saying that's what I really needed. You know what that was? A shot in the arm, and that's what this nation needs. That's the only way I think we're going to get our way out of this. To achieve herd immunity, we have to probably give 240 to 260 million doses of complete vaccines to get herd immunity that we're talking about. So I know the incoming administration has a very ambitious program of vaccinating about 1 million a day. If we can figure out a way to ramp that up, I'm hoping and praying by the fall we can be back to some normalcy. If we can achieve that level of vaccination and people continue to wear masks, socially distance, wash their hands, and avoid spreader events, I think we can get there.
Now, you mentioned that Teche Action received approximately 300 vaccines today. You're going to start administering about 20 of those today. You're going to spread those out among your clinics in the surrounding parishes and hoping to receive more so you can start giving those to patients.
Absolutely. We received exactly 30 vials, 10 doses in each, 300. We will not waste as precious commodity, so we're guarding it like gold. And we have people lined up because after you defrost it, you only have a 6-hour window. So we have people confirmed that we know will be standing in line to give the vaccine to. In addition to that, there's some opportunities that may exist with some Pfizer vaccines coming. And, when we tell people, like doing screening tests for colorectal cancer, and the question gets asked, which is the best test to get? The answer is the one that gets done. So the best vaccine to get is the one that you can get.
Of course, you got the Moderna. Difference between the Moderna and the Pfizer?
Actually, it's not they're both made from the same technology. It's the storage component of Pfizer has to be frozen at 84 degrees Celsius, which we don't have the capability of freezing that and storing it. So we only a few places, large centers had that. So we got the Moderna, which doesn't have that requirement.
And unlike a flu virus, or a flu shot, this one does not have a live virus in it.
Yep, the flu shot does not have a live virus. It has an attenuated virus.
Exactly. Now, you were mentioning a few moments ago that Senator Alland is working to get some retail pharmacies in the parish with the vaccines.
Yes, I've been on the phone with he, and he has been, obviously, St. Mary Parish is a large part of his district, and he has been in contact with the LDH and the governor's office to make sure that St. Mary gets its fair distribution. It's no one's fault, but the way the process has been rolled out has been very challenging. We submitted our information to LDH, and then the CDC is the one that has to dispense, if you will. We have to be a part of the LINKS system, the Louisiana Immunization Network, where everyone who takes a shot has to be enrolled, and then so the state is going to be able to track who all got it.
As far as I know, there is a priority list depending on patients that need it in the Teche Action Network. Basically, how long do you think it'll take? Of course, depending on the availability of the shots, how long do you think it'll take to start getting those their immunizations?
I'm hoping we've got them out soon. The ambitious goal was to get 20 million vaccinations by the end of December. Well, we fell woefully short. We only did about 2.7 million nationwide. Louisiana has gotten its allotment, but just what you just saw demonstrated, the key is getting it from that refrigerator into someone's arm. So that's going to take some logistics. I'm on several committees where we're trying to get community engagement, decrease vaccine hesitancy, the reluctance of some people to take it. And then right now it's supply versus demand. A lot of people have been calling in. A lot of people want to take it. We just don't have it available yet to give it to them, but I'm hoping that'll change soon.
You mentioned people being hesitant. You obviously were the first one here at Teche Action. As the CEO, you wanted to step up and be the example. What do you say to those who may be hesitant, who feel maybe it's not safe for them or their families?
Well, I can say with confidence that I recommend it. I put my arm where my mouth was. I took the shot. I strongly recommend all the research, all the science that has been behind it, the clinical trials. I've read the papers and making that strong recommendation. I believe in vaccinations.
All right. Thank you very much, Dr. Wiltz.
All right. Thank you.